Good morning. Thank you all for coming. Today, Maine Equal Justice Partners in the Maine Center for Economic Policy are releasing a report entitled Federal Healthcare Funding Makes Dollars and Cents for Maine. Maine has an incredible opportunity to alter the lives of thousands of our family, friends, and neighbors who do not have access to quality, affordable health care. Despite working hard every day, too many Mainers are just one illness or accident away from financial ruin because they lack health care coverage. It doesn't have to be this way. The Affordable Care Act has made federal funds available to expand access to health care for 69,500 Maine people who either don't have health insurance or who could soon lose it. States around the country, including those with conservative governors, Ohio, New Jersey, Florida, and Arizona, have recognized the opportunity they have to help working families become more secure. We were pleased to learn yesterday that Governor LePage will initiate discussions with the federal government to explore this opportunity in Maine. The reasons for doing so are compelling. Approximately 128,000 Mainers lack health insurance. If Maine accepts the federal funds set aside under the Affordable Care Act, then 69,500 Mainers will be eligible for coverage come January 1, 2014. The federal government is ready to pay 100% of the cost for the first 3 years for all newly eligible individuals, and after that, the federal government will pay 90% of the cost for these individuals. The majority of the people who would be eligible for coverage are working, but they don't earn enough money to be able to afford health insurance. Maine can protect thousands of its residents from financial ruin following one illness or accident. Accepting federal funds to make sure that everyone can have a family doctor and get the appropriate care when they need it is the right thing to do. As today's report shows, the impact of accepting federal funds benefits more than just those who would gain coverage. It's good for Maine's economy and businesses. It will help to reduce the growth of health insurance premiums for people who have coverage now. National estimates indicate that for the average American family, it could reduce premiums by $1,000 a year because it would reduce the cost shifts that occur when uninsured people seek health care coverage in the emergency room. The economic impact of saying yes to these federal dollars would ripple through Maine's economy, helping to create jobs, provide economic and health care security to working families, and improve health over time. As the New England Journal of Medicine and a study in Oregon have found, people with health insurance are healthier and live longer than those without it. It makes sense. People with health insurance can see a doctor when they get sick and not rely on the emergency room, which is the costliest place to receive care. They can better manage chronic disease, and they can get the right care at the right time. We can't miss this chance to do the right thing for thousands of people, including our family, friends, and neighbors.